Hey, I am April Dixon. I did my intern as a medical social worker. I did it at Piedmont Fayette Hospital, which is a short term acute care hospital, basically servicing local area, and most of the patients are there less than 5 days. A little background on a medical social worker as far as education is concerned. In order to work as a medical social worker within the hospital, you have to have a master's degree. You don't have to have a master's degree to be a social worker. You can have a bachelor's in social work, but in order to pursue a master's in social work, you can have a bachelor's degree in pretty much any area. You can also be a licensed clinical social worker, and you can have a doctorate in social work as well. Within the hospital, they're located in the emergency room, inpatient, mother baby unit, and oncology. If it's a larger facility, it may be other areas that the social worker is in, but for Piedmont Fayette, they're located in these areas. I worked with Toya in the emergency room. She was the ER supervisor, and she is a licensed clinical social worker. So after hours, as a part-time job, she also provide therapy, for another company. Toya made sure that I spent time with other social workers within the hospital. I went to mother baby unit, which was interesting because she have different resources that she used. And I did not know that they also assist in adoption. And their time, the social worker that works in mother baby unit, spending extended time working with the mother once the mother leaves the hospital if she has a baby that's in NICU. Also, I learned that there are travel social workers. We have PRN social workers there, which basically mean on call. You come in if you're short of staff there, but you can also travel. I didn't get the opportunity to talk to the social worker, but she was getting ready to, well, she had taken an assignment in California. So she was getting ready to leave and go to California. I wish I would have had the chance to talk to her. I also went to meetings, and through the meetings, I was able to see all of who social workers collaborate with. And they spend a lot of times collaborating with physical therapists and nurses. And the nurses are called case management. They work very closely with social workers and, of course, doctors. And during this time, with Toya, we had like a little reflection, and reflection helped me understand her personality and how it has, aided her in this career. We're close in age. The reflection wasn't planned; it just kind of happened, and it taught me a lot about myself. My responsibility was a case management assistant. This is a real position. It's covered by a PRN. It's not a part-time position. It's PRN, and it's a non-clinical role. They make information packets, take them to the patients based on their needs, set up transportation. You'd be surprised at how many patients don't have rides home, or they have learned the system and to not bother any family members or to not spend their own money. They'll just say they don't have transportation and the hospital pays for it. We use the Epic system, which is a digital medical records. It's everything in there you want to know about the patient. There are notes that you have to put into this system. You can tell how long the patient has been there, what are the plans for the patients, and this is basically how you communicate to other staff members. You can have instant messaging, which a lot of times I had to check the messages so I know what to do for a patient or who needs what. Objectives. I didn't put all of my objectives on here. I only included three. First one is acquire a clear understanding of the medical social worker profession, such as department, units, department units, job titles, and duties. Well, this was important because I didn't know too much of anything about a social worker. I didn't even know a social worker was in the hospital. I hear social work and I automatically thought foster care. Well, social work a lot of times, well, it shouldn't, but it is staying outside of the hospital. You kind of got to have a little control over once the patient leave there, that's the end of your job with the patient, and connect them to another social worker if they need it, or connect them to whatever resources. And sometimes the social worker is also treated like security. Whenever there's someone wandering around the hospital, the first thing they think of is call a social worker. Even the security guards will call the social worker. Once they've been helped, it's kind of out of the social worker's hand. Um, they're expected and they're told to fix certain problems, a lot of problems. Skills: enhance active listening skills, asking the right questions, and utilizing techniques. This is important because you will be asked to do something, and it's important. Like a nurse may contact you and say, well, this patient needs a ride home. Well, you go assess the patient and you realize the patient is actively vomiting. Well, I can't put this patient in a Uber because they're vomiting. And the nurse will know this. So it's important that you ask the patient the right questions. Is there anyone that can come pick you up that you know? You have to ask certain questions. And also you got to find out, why is that patient there? Well, this particular patient that they called to have put in an Uber was actively vomiting. Well, they were admitted because they had a concussion. They fell and hit their head. Well, that's a red flag. So that patient had to be readmitted. Knowledge: increased knowledge of community resources and continued care services and other patient related services to be provided. Well, once you're done in this short term acute care facility, you may need to stay somewhere longer due to, different reasons of why you're there. Long term, you may have to go to a long term care, which is not a nursing home or rehab. These are like specialty hospitals that are designed to treat patients with complex illnesses, like suffered a stroke or a complicated disease, or you have complex wounds. Also, they may be sent out to subacute rehabs, acute rehabs, hospice, and also you may need to be set up with some home health care. So these resources are important to know. Which you, if you're a medical social worker, you're gonna learn them. And a lot of them have portfolios also too. A little booklet that have all their resources in there. So that's why it would have been nice to have spoken to the travel social worker. I wanted to know, like, how hard is it when you go to an area or somewhere that you're not familiar with? You're going from Georgia to California, you have to learn those resources in that area. So it would have been nice to talk to her. Some things that something to keep in mind is that my duties were kind of limited because it is a position that you have to have a master's degree in. And I was pursuing, I'm finishing up a bachelor's. So I'm kind of limited with what I can do. Um, but I did ask that magical question, the question I had to know, and a lot of people would like to know. So if I was pursuing a master's degree and I was finishing, I'm at the end of my master's degree, and you have a position that's open, would you hire me? And what is the starting pay? She was like, yes, I probably would because we're fully staffed. But if we weren't adequately staffed, I wouldn't. And the starting pay is $37 an hour for anyone that wants to know. Thank you. I hope you learned something.